So my name is Mia Schmiedeskamp, and I'm a pharmacist at University of Illinois at Chicago. And I take care of patients with chronic disease who have liver disease. And I've been asked today to talk to you about vaccinations for people with chronic disease. And I want to start talking about some reasons why you should get vaccinated, or at least consider it. We know that chronic disease increases vulnerability to infections, and chronic disease also increases vulnerability to the damage that infections can cause. The good news is we have many vaccines available against many of these infections, and so getting vaccinated is an easy way to prevent infections and therefore protect your own health. The vaccination that I want to start out with is actually the easy one. This is the flu shot, the vaccination against influenza. And the Centers for Disease Control, or CDC, is the branch of our government that makes recommendations to healthcare providers and also to patients about what vaccines are recommended in the United States. And the CDC recommends that people 6 months of age or older get the flu vaccine before every flu season. And so this works out, if you're an adult, to all adults every flu season. And there are several reasons for this. One reason that's a societal reason is that when everyone gets their flu shot, this helps prevent the flu from reaching those people who are most vulnerable, including the very young and the very elderly. And I just want to point out here that so far in the 2017 to 2018 flu season, as of late February, over 84 children have died of influenza. But for people with chronic disease, the reason to get the flu vaccine is also much more personal. People with chronic disease like asthma or COPD or liver disease or diabetes are also at higher risk for severe illness when they get the flu. And getting the flu vaccine can help prevent the flu. And if you do get the flu, it can help make the course of the flu less severe. A lot of people ask me if they can get the flu from the flu shot. This is a very common question. And it turns out that the flu injection, that vaccination, is actually made with inactivated virus. So you cannot get the flu from the flu shot. However, I note that you can get the flu in the community from people you meet just living your everyday life. And so the CDC recommends that in addition to getting your flu shot, you do your best to keep your distance from people who have the flu. You wash your hands often during flu season, and you avoid touching your eyes, nose, and mouth, because these are ways that the virus gets into your body. The best time to get your flu shot is before the flu even starts to spread in the fall. And this is because it takes about 2 weeks for the flu shot to start protecting you. However, if for some reason you do miss the flu vaccine in the fall, you can continue to get it during the winter, even if the flu is still spreading. If you do end up getting the flu, a lot of people notice fever and very sore muscles and runny nose and headache and very severe fatigue. If you think you have the flu, and especially if you have a chronic disease and you think you have the flu, you should contact your doctor's office to see if you qualify for medicine that we use to try to shorten and weaken the course of flu. And many doctors' offices ask that you make contact initially by phone so they can give you instructions so as not to infect their other patients. So the flu turns out to be the easy one. It's recommended by the CDC that adults get it every year. Pneumonia is a little bit more complicated, and so I want to spend some more time talking about pneumonia. You may already be aware that pneumonia is a common cause of illness in people with chronic disease. It turns out it's also a common cause of illness in people who are older. And the most common cause of pneumonia is a bacterium called strep. Some people call it pneumococcus. I have a picture here from an electron microscope so you can see what pneumococcus looks like. This bacterium, in addition to causing pneumonia, can also cause blood infections and meningitis, which can be severe. And really everyone, when they're children, get vaccinated against pneumococcal disease as long as they get the full battery of childhood vaccines. However, even if you got your full childhood vaccination, including your childhood vaccination for pneumococcus, you may need more doses of pneumococcal vaccine as an adult. And a really great example of this is people with chronic disease. So people with chronic disease such as diabetes, or heart disease, or liver disease, or kidney or lung disease need an extra dose of pneumococcus vaccine as an adult. And this list of chronic diseases that require additional vaccination against pneumococcus is by no means comprehensive. And this is why it's very important, if you have a chronic disease, to talk to your doctor about whether you are somebody who needs vaccination against pneumococcal disease as an adult. Other people who require extra doses of pneumococcal vaccine are people who are over the age of 65 and smokers. One of the reasons that it's super important to talk to your doctor about this in detail is that there are 2 different pneumococcal vaccines. And some people only need one of them as an adult, but many people who need one will also need the other. And so your doctor will be key in looking up the correct number of vaccines to give and thinking about the order in which to give them and planning out the timing or spacing between them. As you have this conversation with your doctor, the following terms may come up. There's the PCV13 vaccine, which is the pneumococcal conjugate vaccine. And there's the PPSV23 vaccine, which is the pneumococcal polysaccharide vaccine. And if you know that you've recently had either of these, definitely let your doctor know as you're having this conversation, because it may mean that your doctor needs to have you wait a while to get the other vaccine. So pneumococcal vaccines are critical for people with chronic disease, also a little bit more complicated, but that's where your doctor comes in. Another set of vaccines that's important for people with chronic disease are vaccines against hepatitis A and hepatitis B. So the hepatitis A and B viruses cause liver injury. Interestingly, hepatitis A is usually transmitted via the fecal-oral route, which means that many people who get hepatitis A have gotten it, for example, by eating contaminated food, for example, when a food worker doesn't have perfect hygiene. Hepatitis B, on the other hand, is transmitted via blood and certain other bodily fluids, and it's most often transmitted by sexual contact or needle sharing. And the CDC recommends that people become vaccinated against these viruses who are either at high risk of getting these viruses or who are at high risk of being injured by these viruses if they did get the infection. So, for example, people who should get both the hepatitis A and the hepatitis B vaccine, who are at high risk of injury if they get these viruses, include people with chronic liver disease, people who are awaiting liver transplant, and those who have already had a liver transplant. Examples of people who are recommended to get both the hepatitis A and hepatitis B vaccines because of increased risk of exposure to the viruses include men who have had sex with men and people who have used illegal drugs. For hepatitis A, another really good example of people at high risk of being exposed to the virus include people who are planning travel to areas where hepatitis A is quite common. And if you're planning travel, you yourself can look up on the CDC website to see if your destination has a high rate of hepatitis A infection. And this is also something that your doctor can help you determine. For hepatitis B, there's actually a fairly long list of other people with increased exposure risk. And then people with diabetes, interestingly, and people with end-stage kidney disease happen to fall on this list. And so if you don't know that you're already immune to hepatitis B, this is a conversation that you should have with your physician to find out if you fall on this list of people at risk for increased exposure. I want to talk a little bit about the tetanus vaccine, not so much because it's critically more important for people who have chronic disease, but just because all adults need a tetanus vaccine every 10 years. So even if you've been vaccinated against tetanus as a child, every adult should get a tetanus booster every 10 years. This booster prevents tetanus, and anyone can get tetanus from bacteria that can get into wounds, especially in your feet, as is shown in this picture. And it also prevents diphtheria, which is a disease that quite fortunately has actually been made rare now by vaccination. At least once in your adolescence or your adulthood, your doctor will give you one of these tetanus boosters in the form of a vaccine that also protects you from pertussis. And pertussis is a respiratory disease that is unfortunately on the rise again in this last decade. And we know it can be especially serious if tiny infants are exposed. A more common name for pertussis is whooping cough that you might be familiar with. And so to protect you and also to protect your family, at some point in your booster series, your physician will want to give you a booster that also protects you from pertussis. The final individual vaccine that I want to talk about also doesn't relate quite as much to chronic disease, except that it relates to many adults. And I feel like I would be wrong to omit it because there's a new shingles vaccine that I want to tell you about. If you have had chickenpox, you are at risk for getting shingles. Another name for shingles is herpes zoster. This is a painful outbreak of blisters where the varicella virus that once caused your chickenpox still resides in your body. And on the right is a picture of a person who has these blisters that represent shingles. The blisters do eventually go away, but unfortunately the pain that can accompany them is quite severe, and that pain can often outlast the lifetime of the blisters. The shingles vaccine can prevent outbreaks like this. And there is a new vaccine approved last year in 2017 to prevent shingles. It's called Shingrix. And this has caused the CDC to update their recommendations. The CDC used to recommend that people get a shingles vaccine using the old shingles vaccine called Zostavax if they were 60 and older. With the appearance of Shingrix, the CDC now recommends that people 50 and older get Shingrix to prevent shingles. And this is true even if they've had shingles in the past, even if they've received the Zostavax vaccine before, and even if they are not sure if they've had chickenpox. So the shingles vaccine has been updated in the last year. Two more topics that I want to touch on, and one is missed childhood vaccines. So many people get a whole battery of vaccines during their childhood and their adolescence to protect them from some of the infections that we've talked about so far, but also for things like mumps and measles that we haven't talked about so far. However, there are people who haven't gotten these standard childhood vaccinations. This can include people who were raised outside the United States, where vaccination was not routine. And within the United States, it can include people whose parents decided not to vaccinate. If you are somebody who did not receive your full panel of childhood vaccinations, this is an important issue to revisit with your physician as an adult. And this is especially true if you have chronic disease, because any of these diseases, should you contract them, could be more serious in a person with chronic disease. So if you haven't had these vaccines, revisit this with your doctor. And I note that some of these vaccines cannot be given after organ transplant. So if organ transplantation is something that you are considering for the future, this is an especially important conversation to have early. The final topic that I wanted to touch on regarding vaccination is travel vaccines. And interestingly, many countries that you might choose to visit have requirements for vaccinations for you to be allowed to enter the country. On the flip side, some of these countries have high incidences of infectious disease, which make it wise for you to make sure that you're vaccinated before you leave. So sometimes it's a requirement to travel, and sometimes it's simply a recommendation to protect your own health. Your doctor can help you look up requirements and recommendations for your travel destinations. And this is also something that you can research on the CDC website if you want to look into it before you choose your travel destinations. As I've referred to throughout this talk, the Centers for Disease Control is a great resource for information on vaccines. It's really the primary resource for healthcare providers. The CDC publishes a book called the Pink Book, which is the gold standard resource that healthcare providers use to determine which patients should receive which vaccines. But the CDC also has a lot of information that's intended for everyday people. And so if you have any questions about vaccines, as you work through thinking about what vaccines you might need or might be missing, the CDC offers lots of information for patients in a really easily digested form, and also many handouts. So I highly recommend the cdc.gov website. And I want to thank you for listening to this webinar on vaccinations and chronic diseases.